Story of COVID in Tajikistan. Hi, hello, and welcome to Dr. Medicine. We bring you daily medical updates. Let's start with some predictions. According to World Bank experts, in Tajikistan, severe coronavirus infection of COVID-19 can affect between 72,000 and 230,500 peoples. The first case was reported on 30th April. Well, this is not the beginning of the story. The story started months before. Before we start the video, let me tell you one thing clearly, that the whole story was based on a deep studies and the link of sources are given in the description. Feel free to look. First of all, I would like to tell you about the Indian community. You may ask why India. In between that, I will tell you in the end of the video. Tajikistan is approximately 1,500 Indian people, including 1,287 Indian students, pursuing medical education at Declaimer Tajik State Medical University. Well, as I said you earlier, the actual crisis started months before. Pneumonia was the synonym of COVID in Tajikistan. What? Yes, it was officially reported in Ministry of Health's page about the rising number of pneumonia. On the month of March, the peoples were unknown about the COVID-19. Even President was playing with the life of people, Sug News reported. The President will take part in the celebrations on 22nd March, on the occasion of anniversary of the independence of Tajikistan. According to various sources, 7,000 to 12,000 people will be involved in a theatrical performance in the stadium, the best place for COVID-19 community spread. Tajik share common border with China, Afghanistan, Uzbekistan and Kazakhstan, where the cases were already reported. Moreover, the China is the suspected place of corona origin. Initially the memes began to appear in the end of March. Tajikis are asking to the world community, what's coronavirus? On 5th April, news began to spread in the Indian newspapers that the Tajikistan is free from coronavirus and the country is planning a football match in the coming days. It was all because they wants to show the world they are safe. The same news with the same content appear on another newspaper on 6th April. On 13th April, Fair Observer News reported that COVID-19 is expected to spread in Tajikistan. A few cases will probably soon be reported officially, simple for reason of credibility. But the numbers will likely remain low, and who is going to verify them anyway? Same day, a doctor at the Dushanbe City Hospital rejected suggestions that officials were not being transparent about the coronavirus in Tajikistan. A coronavirus infection is not something that officials would be able to hide from people for long. It spreads very quickly. He added he wasn't authorized to speak to the media. Now, I will show you one pic. Regular meeting by health department to prevent the COVID-19. Oops, wrong picture. This is Vietnam, and this one is Tajikistan. No social distancing, no mask, and discussing how to save the people. But who is going to save them anyway? On 22nd, Eurasian Net News reported, Tajikistan, 4 more death pinned on pneumonia, and some medias claimed the deaths are due to coronavirus. It was not the first case. I am briefing the whole content. On 23rd, the MOH came with an explanation. The Ministry of Health and Social Welfare denied rumors of the death of 3 citizens who allegedly died at Medical Center Number 1. They said the deaths were due to pneumonia infection. Same time, Eurasianet News reported, until the virus become a mass phenomenon, the authorities will hide the fact. The health ministry says it has 100 ventilators, but that claims too cannot be accepted at face value in light of how routinely the Tajiki government trades the lies. On 24th April, head of WHO in Tajikistan said, it is impossible to categorically state that there are no cases of the disease in the country. Same day, Sputnik News reported the death of first doctor in Tajikistan. Meanwhile, in the month of April, it was a common sight that the health workers wearing PPE and disinfecting the city. Is PPE kit used while treating pneumonia? That's a big question mark. 25th April, Asia Plus reported, in all schools, kindergarten, of the capital of Dushanbe, temporary vacation are announced from April 27th, but the decision does not apply to universities and secondary vocational schools. 26th, a revolutionary strike took place. South Indian students of Avicenna Medical University began to boycott the classes, demanding to conduct online classes, or suspend the classes, because they the future doctors know the real situation. Same day 11 people died in Kerala State Hospital, which was not reported in any media. 27th, Ozodi News reported, 11 more people died due to pneumonia. Do remember these statistics always remains less than the actual cases, according to MOH. 11 of 319, admitted to the medical center in Dushanbe, on suspicion of having pneumonia have died so far. Authorities said, about half of these patients are doctors. Doctor, yes. Meanwhile Asia Plus reported, MOH officials said, that the coronavirus is not registered in our country. The incidence of pneumonia is increasing due to seasonal climate change. On 28th, the leader of the Social Democratic Party in Tajikistan said, there is coronavirus in Tajikistan and it has been 3 months. We are already late with 2 stages of fight, and now 3rd stage going on. Do you remember the medical students' strike? It has came to an end. The revolution won the game. The university classes were suspended. Later Ministry of Education and Science of Tajikistan confirmed that the season of exams and training in the country's universities began much earlier than planned. It's about 1 month prior, and finally 30th April was the day. The first time Tajikistan confirmed 15 cases of COVID-19. It was not an easy task for government. It was the result of continuous crucifixion of media, and direct involvement of organizations like WHO. Same day, from 15 the case raised to 32. Now, I would like to show you a WhatsApp chat of a doctor who works in Tajikistan. Look closer to the screenshot. He is telling, the official report of 32 infected is a big lie. It's currently minimum 1,500 plus cases. Smelling something fishy. Move on. Let's discuss the officials. On 2nd May, a Tajiki girl posted a video of State Hospital along with the caption, I ask you the Ministry of Health, Karaballo Hospital needs 6 more cylinders of oxygen. There are so many sick. The elevator is not working. Please help people. I am screaming for the first time to save my mom. She had a good mass support, and the comment section was fully against the government. Now, if you don't laugh, I will show you something that's written in MOH page. Service delivery in health sector of the Republic of Tajikistan entered into international standard. Really? Sorry, I'm unaware about it. Same day, the first 2 cases of death were reported, with 76 infected and 0 recovery. 3rd of May, 128 infected, 2 death and 0 recovery. From then the cases began to rise. 4th May, 230 3 0, and finally, today, coronavirus cases confirmed in all regions of Tajikistan. 8th, 522 12 0, 12th, 661 21 0, 16th, 1322 36 0, 17th of May, 1524 39 0, and today, Tajikistan got a new record. Tajikistan has the most death from COVID-19 in Central Asia, in a deep comparison. Kazakhstan, first case reported on March 13th, current death rate is 34, and Uzbekistan, first case reported on March 15th, current death rate is 11, and about Tajikistan, you already know, both other countries, cases reported 2 months earlier, and Tajikistan just 17 days. 18th of May, 1729 41 0, then suddenly, 20th of May, 1936 41 641. What? 641 recoveries? 20th day suddenly a dramatic change. Wow. Anyway, let's move on. 21st, 2350 to 44 to 470. What? 641 now became 470. Recovered got reinfected? Maybe, because this is Tajikistan. 22nd, 2551 to 44 to 1089. From 20 to 21st, 171 cases were reduced. From 21st to 22nd, 619 recovered in one day. Tajikistan model, a role model to world health sector. I'm gonna request a blueprint of their strategy. 23rd, 2738 to 44 to 1223, which means 100 plus recoveries per day. And currently on 28th of May, 3424 cases, 47 death, and 1575 recoveries. I forgot to tell you about one thing. On 9th May, Tajikistan was added to VBM, which is one of the biggest airlifting mission launched by the government of India, initially aiming to bring back Indians stranded in various countries. Soon, protest began to start. For 1,287 students, Indian government allotted only 2 flights, which can hold up to 150 passengers each. Then the student got media attention, and the news began to appear in Indian newspapers and news channels including Asianet News, Manorama News, Mathabhumi News, Janam TV, Media One, News 18, News 24, etc. News links are given in the description. Thanks for watching. If you like this video, also please do watch our previous videos, and don't forget to like, share, and subscribe.